G'day and welcome back to the channel. So in today's video, I want to show you how you can use a massage gun to help improve shin splint pain. And the idea with this video is there's certainly some techniques that you can use with a massage gun that may assist you with symptomatic pain relief and symptom management. But when talking about shin splints, it's really important that we also take a step back to try and understand why has that exact part of your leg become sore in the first place. And while I do have some videos addressing some of these underlying factors on the channel already, if you have a massage gun lying around, there are specific parts of your leg that you can put that massage gun into to try and improve the overall biomechanics of your leg to help you better load up your shins and hopefully address some of the factors that are leading to your shins getting sore. So let's get into it. So as I mentioned at the top of the video, massage guns can be a helpful tool to use to manage symptoms. If you have some tight musculature, if you're trying to recover, if you're trying to manage your pain. But like we always try and promote with anything to do with massage guns, it's really important to understand the context that a massage gun on its own will never cure you of your musculoskeletal aches and pains. The reason for that is because those musculoskeletal aches and pains are often a consequence of the way that you load up that exact area. We know that tight muscles aren't just randomly tight, they are requested to be tight because of something else. So if we're not also looking at your underlying biomechanics, and again with the previous videos that I've done on shin splints, we can give you a better understanding of how your ankle joint stiffness plays in this, or how tightness at the front of your hip or lower back dysfunction might also be flowing down to ultimately end up in a consequence where your shin splints develop or are given an environment where they can potentially develop. And while a massage gun can be very helpful in making those symptoms feel a little bit better, if you're not also working on the underlying restrictions, potential weaknesses, postural dysfunction, then you may never get to the stage where you don't have to keep using a massage gun to manage those symptoms. So starting up your massage gun, what we're looking for is obviously with shin splint type pain, we don't have to get bogged down too much in which structure is irritated, whether it's the tibial bone itself, whether it's the tendons and the muscles as they attach and interact with that bone. If you have a massage gun, what we're looking for are things that aren't bone that feel tight, tender, and potentially restricted. And while typically we tend to focus a lot on the inside of that shin, we don't want to neglect anything on the outside of that shin either, because that can all influence how you load up that tibial bone. Interestingly, we're also just as interested in your calf tissue at the back. Again, as I covered in previous videos before, the idea here is that if you're lacking some range of motion and some function at the back of your leg, your ability to absorb the forces that go through your leg and also through your shin become diminished. So not only do we want to go through the muscles at the front on either side, but if we're not also looking at some of the tissue at the back of your leg, then again, we might be missing some of the features that might be directing some of the forces to overload the front of that shin. So as mentioned, where we want to start is we want to start on sort of the front outside, so the tibialis anterior or any of the tissues in that section. What we want to do, we want to start up nice and high, and we don't just want you to gently roll the massager through your musculature and hope that it helps. What we can actually do here is that we can put some gentle pressure into that area and imagine that you're pushing down and trying to shear free some muscular tightness where the vibration from the massage gun is almost a bonus. So we can use the ball head to get into some tight spots. Again, you can come as wide as you feel comfortable, getting in there, trying to make a respectful indent into the tissue, but also trying to push down and across with that tissue. Now, with a lot of massage guns, you don't want to push too hard. We're going to find a level that feels comfortable, tolerable, and respectful to you. We want to come as close to the bone as we can without necessarily going onto the bone. You don't need to be there. It's not going to feel nice for anyone, let alone someone whose tibia might be a little bit irritated or annoyed. But paying close attention to where you feel the most tightness. If you can work from the bottom of your knee all the way down the side of that leg, that should help soften up some of that tissue or at least increase the mobility in some way. The other thing that we can do here is that because a lot of this tissue is lengthened when you point your foot, what we can do is we can get some pressure on those same tight spots. And if you maintain that pressure, you can gently pull your foot through to try and shear that tissue free underneath the massage gun head. But you don't necessarily have to be massaging with the gun. You can put some pressure through it and drag through it, or you can pin some tissue down and then actively use the vibration to assist in releasing that tissue. And then as with all of this, what you should feel is we're looking to feel looser and freer and lighter potentially than what you did before. What I always recommend people do is that before you do any symptomatic massage type treatments, move around, jump, hop, go for a little jog just to see how your shin pain feels to begin with. And then as you go through each compartment of your lower leg and hopefully feel like you've mobilized it and it feels a little bit lighter, immediately go back and do the same test that you did before to gauge if anything is instantly changed. Because if you hit one particular spot and it feels particularly tender, even though it's not exactly where your shin pain might be, and once you free that up a little bit, you immediately feel like your symptoms are better, then you know that that exact part of your leg that you found was an important piece of your shin splint pain puzzle. And then as we go through all these other areas, you can take that same approach to see how valuable each compartment of your leg is in generating or perpetuating that shin pain. So once you've had a look at the front/outside of that shin, we can also come towards the inside of that shin. And this is important because you've got some calf tissue, your gastrocs, your soleus, which is a little bit deeper, but you also have a lot of the muscles that merge into tendons that go down into your foot and affect the function of your foot and ankle. So same deal, we don't want to be on the shin bone at the front, it's not enjoyable. Same approach, starting right up against it though, coming down through there, you might find that there's some genuine spots here that feel a little bit tight, a little bit ropey, a little bit uncomfortable. Again, same concept, you want to gently put some pressure through that part of your body, try and shear that tissue free with a bit of pressure, or depending on how tender it is for you, we can keep the constant pressure there and then bend and flex your foot to try and shear that tissue free. So I found a particularly tender spot here for me. I can use the different techniques to try and shear that free, and then just making sure that I go down as low as I can, looking for anything that feels meaningful. And then once you've spent some time successfully feeling like that tissue has mobilized and has become a little bit lighter and a little bit freer, again, go hop, go jump, go run, go do something that you did before that'll instantly tell you what effect, if anything, mobilizing that part of your leg with a massage gun has had on your symptoms. And then once you've addressed some of the tissue on either side of that leg, as I mentioned before, we don't want to neglect any of the tissue at the back of that leg that, when tight and restricted, might be changing your ability to absorb impact while moving and changing the way you're loading up your tibia as a result of that. So same concept as before, make sure that I'm digging into that tissue and pulling the massage gun through that. Again, to encourage the head of the massage gun to massage free some of that tight soft tissue, but obviously with the benefit of the vibration to hopefully assist that even more. And so for here, I found a particularly ropey spot for me. So again, I'm going to pin that down and then I'm going to bend and flex my ankle, trying to maintain that same pressure. And all of a sudden it's starting to feel a little less tight, a little less tender and a little less ropey. And I can keep working my way down, all the way down the back of that calf. And as I've been doing with each one of these techniques, immediately then do some hopping, some walking, some jumping, some running to see what freeing up the tissue at the back of your leg is doing to how you're loading up your tissue at the front that may be contributing to your shin splint pain. As always, as simple as those techniques were, it's really important to reinforce that just using a massage gun lightly over the top may not be the best way to use that device. We need to get in there and try and create that massage effect with the head of that massage gun. We can also pair it up with a tack and floss or an active release technique to again optimize the benefits that you're getting from your massage gun. And for the purposes of this video, I was using the Bob & Brad T2 massage gun. If you're in the market to pick one up, I'll leave a link in the description for this massage gun as well. As always, I genuinely hope that that was helpful and insightful. Please check out the other shin splint videos for more context around what you could be doing outside of using a massage gun to hopefully get to the root cause of why you've developed shin splints in the first place. Please leave a like on the video if this was helpful, subscribe to the channel if you want to see more content like this. Once again, thanks for watching and I'll see you next time.